There's new concerns about highly contagious new strains of COVID-19 spreading across the U.S. It could threaten a trend that some experts say is a plateau in severe cases in the country. Fewer than 120,000 Americans are currently hospitalized, and that is the lowest total in nearly a month. But the numbers are still dangerously high as millions of Americans find trouble getting vaccinated. Mola Lenghi has the latest.
It's a desperate race, getting vaccine doses into arms before the new, far more contagious variant takes hold. The UK variant now detected in at least 22 states amid a stark warning today from British Prime Minister Boris Johnson that the new strain could be 30% more deadly. All as the United States faces a vaccine reckoning.
We will, by the end of today, fully utilize all of the dosages that have been delivered.
In hard-hit California, this frontline worker just got her first dose.
But applying for the second vaccine has been a nightmare. I trusted the officials when they said, okay, we got you, healthcare workers.
California today setting a record for COVID deaths. In Los Angeles County, 14,000 have now died from the virus, 4,000 just since New Year's Day. In this neighborhood, a clear sign of the times, warning of the risk. Well over 400,000 lives lost nationwide and lost opportunities to address the crisis sooner, says Dr. Anthony Fauci, interviewed for CBS Sunday Morning.
We could have saved a lot of lives. Is that a fair statement?
I believe so. I mean, I think if we had the public health messages from the top right through down to the people in the trenches be consistent, that things might have been different. In fact, I'm pretty sure they would have been different.
The latest push from the CDC calls for all masks to be worn in public and should have at least 2 layers of fabric. COVID's toll on healthcare workers profound.
I have constant anxiety.
Lindsay Johnson is a Houston nurse who has worked nonstop with COVID patients. This is what affects her most.
When you see a virus killing people, and then you hear people wanting to argue about it, it wrecked me.
New guidance from the CDC. Health officials now say you can receive your second dose of vaccine up to 6 weeks after your first shot. But Dr. Anthony Fauci notes that ideally that is the exception, not the rule, Lana.
Let's hope. All right, Mola, thank you. Dr. Teresa Amato joins me now. She's the Director of Emergency Medicine at Long Island Jewish Forest Hills. Dr. Amato, always good to see you, and always thank you for the work that you do. So President Biden wants to administer 100 million vaccine doses by the end of April. As people have been pointing out, 100 million doses doesn't necessarily mean 100 million Americans who are vaccinated. How realistic does this target look to you, especially as we're hearing from these reports that they have major shortages of the vaccine?
I think it's a lofty goal, but I do think that we need to set these type of goals if we're going to start moving forward and really have a campaign of vaccinations that will really turn this this pandemic around. So again, I think that, you know, if the federal government working with the states really goes full in on this, I do have hope that we can actually meet the goal of the president.
Well, the CDC now says that you can receive 1 shot of Pfizer's vaccine and 1 shot of Moderna's vaccine at least 28 days apart in, quote, exceptional situations. This is some major news. What do you think about this change? Do you worry about the safety or effectiveness of the vaccination process by mixing 2 different vaccines?
So I think what the CDC is trying to do is to try to really look at what would be the worst case scenario, right? So if we don't have enough of these vaccines, God forbid, when the time comes, what is plan B? You know, what can we do as the next best step? And, you know, I'm going to tell you in emergency medicine, we don't like to, you know, we say don't let perfect be the spoils of doing the best that you can. So although this was not originally the advised way of doing this, I think that the CDC is really trying to think about, you know, what do we do going forward to try to get as many vaccines as we can. As far as spreading out the vaccines a little further than the studies showed, you know, when you think about it from an immunological point of view, it really shouldn't make that much of a difference, and if any at all. I have been listening quite a bit to Dr. Fauci today, and, you know, he is the expert on this, and he doesn't think that it's going to be an issue if we need to spread out the vaccine. I will tell you, in general, sometimes vaccines can't be given exactly at the right time, whether somebody's traveling or fell ill. So it's not unusual for us to look at the vaccine dosages and how frequently we give them. Hopefully none of this will happen and people will get the vaccine at the time that we think they should. And hopefully they will also get both the same vaccines, the same, either the Pfizer or the Moderna as their 2 shots.
Dr. Amato, British Prime Minister Boris Johnson says that the new COVID variant in the UK appears to be more deadly. We have been talking at length about how it was more infectious, but at that point we were saying it didn't appear to be more deadly. Now we're hearing that that might be incorrect, and this variant is already spreading here in the United States. We're hearing about calls for additional mask wearing, not just one, but multiple layers of masks. So what about this strain is cause for concern? And what should we be doing about it?
Right. So there's not much we can do about the fact that the virus is mutating. We know that that's what viruses do. They want to become more and more infectious and spread more easily. So not surprising that we're seeing this. I think this is really a reason for us to be as vigilant as we can about our mask wearing and our social distancing, keeping 6 feet apart and wearing our mask when we're out in public. The good news is, Pfizer has been looking at this, and it does show that the Pfizer vaccine, should be just as efficacious against this strain. So that's the good news. We're going to keep going with the vaccinations and continue to have people really think about keeping their mask on as much as possible and staying 6 feet apart. And again, avoiding the large gatherings that we know can be super spreaders. If this virus becomes more contagious, then those kind of gatherings will really just spread it, more and more each time that people get together in those large groups.
All right, Dr. Amato, as always, thank you.
Thank you for having me.